While you guys are eating, I'm gonna talk, so just keep eating. Not gonna offend me by eating what I do. So, I'm Jason Owens. I'm the principal at this wonderful facility. Thank you for coming and using this wonderful facility because it's way better when there are people down here. When I look at the camera, it's dark and I'm like, eh. So I'm glad there's people down here. Some purposes for our meeting today is we're going to refresh our collective knowledge from last meeting. We're going to share some resources. We're going to try to build a list of locations to connect with parents. And my favorite part, we're going to role play.
Nobody can leave when we role play.
A parent engagement gathering. So
I'm so excited. Tell the Zoom people that too. They can't.
does anybody want to approve the minutes from the last meeting? Thank you, Kathy.
I move to approve the minutes for the last meeting.
Is there a second?
I'll
second. All right. And now Alex is going to talk to you guys about some fun stuff.
All right. Thank you for being here. I think, do we have anybody who, this is your first meeting today? A couple. Thank you for coming. We're really glad that you're here. And if there's anybody on Zoom, thank you for being with us. So there are laminated sheets in front of you, perhaps close by. There's an orientation session on, I think, the 15th of March for this group. And so we'll make sure that you're connected to that if you're interested in going. It's a brief session, but these documents are kind of how we got here. There are tools that frame our decision-making and how we measure the impact of our work. But this page in particular that has, it looks like a flower petal. These are the priority areas that have been identified by the Wellbeing Collaborative. And you'll see one child and youth, and that is this work group. We're the child and youth work group, and we're the first of the work groups to get initiated and start. And then you'll see the circle says impact. And that in the impact circle, those are our areas of focus or our goals. To increase the access to information, resources, trainings, programs, and services. And the first one is to prevent persons from entering or re-entering the system. And while we go with that word system, it's not necessarily the best word for what we're talking about, because there are very positive systems that support our children and our families. So these are more systems that children may end up in because they haven't perhaps made the healthiest choices for themselves. We are open to other words for that meaning. And so if you come across a great way to phrase that, we would. So this is a nice roadmap of where we started and a good reference point for us. And one of the things that we always like to do as well is let you know that there's a document that you can put your organization information in and the resources that you provide, and we share that among our partners here. So we encourage you to do that. And Matt, I don't know if you got or how they can access that.
So the easiest way for today's meeting, back there on the resource table, we have it's on big 11 by 17. We have the current list, and then we have the QR code. If you don't see yourself on that list, you can fill out the form. And then otherwise, if you go to our website to the 2030 page and scroll down all the way to the bottom, we didn't get a chance to update it before the meeting, but tomorrow morning it'll be updated. We'll have that on there, as well as a link that you can click on instead of having to scan the QR code as well. And then that'll get your information updated on that spreadsheet, and we'll bring that to each meeting, and we'll also get it updated on the website too.
Thank you.
All right, so resource sharing. If you guys have any resource brochures, flyers, you can either pass them around or you can leave them back there on the table, which it looks like some already have done. We'll go around. If you have anything to share, introduce yourself. We would like to keep it under a minute per person. If we can, that would be great. I'll start. I'm Erin Small. I'm a Sixth Sense Child Care Partnership Coach. The only thing new we have going on right now is on March 14th, we're having a recruitment meeting with child care providers with Rooted in Relationships and Sixth Sense, because we're both looking for some new partners.
I'm Dulce Valdez, ES9 project coordinator for the migrant program. I think the only thing that I found right now for us is we're just planning for summer services, and adding new stuff to our team. One event that involves parents, is not happening on March 3rd, by teachers. We're going to have closed giveaway for parents and students. So I think that would be an opportunity for us.
I'm Ken Schaefer, a retired pediatrician. I'm working for a Buffalo County Community Partners. I probably represent the healthcare clinic here. I didn't see anybody else around the table. See patients there. And the other one I'm involved in is with Beacon and mental health. So I've been involved in mental health, and integrated pediatric practice, 20, 30 years.
And then Martha McCann, with Buffalo County Community Partners. The resource that I was gonna share, and I have the flyers over by the resource table. On March 10th, we're gonna have a local food leaders workshop, and so this would be for anyone who's interested in food insecurity. We'll have lunch available, registration is open, and so it has a link on there. And this would be to help bring those interested in food insecurity, create a community food system. So if you want to be a part of that, you can get more information on the resource table with the flyer, or you can email me with any questions that you have.
My name is Dan Endorf. I'm the Director of Student Services and Safety with Kearney Public Schools. Recently, we brought representatives from our migrant program together with other leaders across our district. And it was fascinating, number one, but number two, just talked about coordination of services with many of you and the jobs you do. So that's great.
Dave Cool, Lieutenant of Kearney Police Department. Just a couple things we have going on, I guess, with youth. Currently, they're taking applications for Youth Citizens Police Academy. So if you guys know any high school students that want to learn more about law enforcement, want to give up one night a week in June. The kids that have done it last year was our first year we did it. Really enjoyed it, really liked it. It was really eye-opening. Besides that, there's a scholarship. You know, any seniors that want to be a police officer down the road. That's through Chamber of Commerce and Friends of Law Enforcement Group. So encourage them, you know, anybody that potentially wants to study criminal justice in college to apply for that scholarship. So things that currently are going on with the PD.
What are the ages of the academy?
9 through 12. So just any current high school student or just finishing high school.
Buffalo County Community Partners. I'm Ryan Hughes with Buffalo County Community Partners. I'm Ellery Butterfield. I'm the youth coordinator for the Community Partners. And we don't have anything going on this week, but it is Teen Dating Violence Awareness Week. And one of the gaps that we've noticed both from our DAP data and just in speaking with the youth is that they're saying they'd like to be more connected with the adults in the community. And then there are a group of students that aren't very well connected. And so I would encourage, if you guys haven't ever checked out the Search Institute, they make a lot of these fun little activities that just make it super easy for you to ask questions. These are what we use before our photo voice classes and what we use before YAP. So if anybody wants to check these out, they're going to be sitting on the resource table back there.
I'm Penny Parker with Nebraska Total Care. We're one of the Medicaid plans here in the state. We just want to remind everyone that February is American Heart Month. So if you're working with our members, please encourage them to get their blood pressure checked when they are at their doctor's appointments. They can log on to their secure member portal on our website in order to update that, as well as their health risk screening. And then the second thing I have for Medicaid is just a reminder that redeterminations for Medicaid eligibility are starting March 1st. Maybe you've heard about it, but essentially during the pandemic, the state was not determining eligibility for people on Medicaid, and they are now restarting that. So we have about 80,000 Nebraskans that have never had to reapply for their eligibility for Medicaid that could lose their insurance over the next 12 months. The most important thing for them to do is make sure their address is up to date with the state of Nebraska through accessnebraska.ne.gov, or they can call their health insurance plan if they have questions. And then I have a few things for the ARC. So I also am on the board for the ARC of Buffalo County. Buddy bowling has started. It's an 8-week program. We started last week. We're bowling again today. We've got about 60 bowlers and maybe 35 volunteers. So if you have any high school age kiddos or college kiddos, we even have a couple middle school students from Kearney Catholic that are helping. It's from 4 to 5 on Wednesdays through April 12th, and we do take that Wednesday off during the spring break at UNKS. And then we've got some really fun stuff coming up for March. March is Disability Awareness Month. So we're gonna restart our Girls Nights Out. They'll be meeting March 14th at Perkins at 5:45. They'll have a painting session with Diane March 23rd. So we have an adaptive Easter egg hunt planned at Shroff Medical Gym in partnership with a couple places here in town, like Family Physical Therapy, the YMCA. So they will have to register for that, but it is free, just like, you know, how many people are coming. Great for people in wheelchairs, and their siblings can come with them, and they're included in that kind of activity. And then March 30th, we're planning a Disability Awareness Month social mixer. So more to come on that. We're also planning to show the movie Champions at the World Theater on March 28th. It's starring with Woody Harrelson. If you've not seen the trailer, he basically does a terrible job as a coach in the NBA and is forced to coach a special needs team. And it's a very heartwarming story. And our Special Olympics athletes in town will actually be going to Omaha March 30th. So it kind of coincides with their trip up to state. Like that. Sorry, I get so nervous when I'm talking.
Thanks. Well, I'm Renee Axman. Some of you may recognize me. I was around for 16 years doing the nutrition education program. I have switched hats. I am now the statewide youth tobacco specialist. And so I am really still learning a whole lot. So what I can tell you I've been doing, and I want to make this clear, so I'm going to be a resource clearinghouse is basically my capacity. So the next thing I'm going to tell you is I went into Lexington High School and I taught for 2 days. That's not what I'm probably going to want to do. But I learned a lot of things. My key goal, I guess, I really want to know from the youth, what's going to stop you from using commercial tobacco products? What can we do to help those of you who have started using tobacco to stop? I think when it's coming from the youth versus me conjuring up some great idea, it's going to be more effective. So I came back with a wonderful slide deck that I have available. I will take that on to the state HOSA convention in March. And then I'm so excited. I'm partnering with Tobacco Free in Hall County to do a takedown tobacco event. So I'm pretty excited. I made the conscious decision. I know I could have gotten something great done here in Kearney, but I am statewide. So partnering with another new kid on the block over there in Grand Island, we should have 50 to 60 kids for that. So I'm pretty excited, and that will include youth advocacy. In the past, there's been a lot of youth board kind of emphasis and looking at policy, and the best way we know to change behavior is actually talk about what does a tobacco-free campus look like, what should the disciplinary kinds of things look like. So I'm also working on being trained in Catch My Breath, which is a wonderful resource that actually is free to teachers. I'm going to do a train the trainer so that if they need help and I need to go in and do some training for school administrators and staff, I can make that happen. There's so much. I'll just end it by saying I also have control now of the No Limits website, if anybody's familiar with that. I think the last entry that I noticed was 2020. So that is now in my possession. It feels like it's a little cumbersome. I do have a little bit of knowledge of WordPress, but maybe knocking on some doors if anyone knows how to run that a little more efficiently. But again, statewide, my goal then is to assist you with being a clearinghouse for resources. We will also have, I'm going to say we're going to do this because if I don't, it won't happen. We will have mini grants available starting in the fall of 2023, where schools can ask for funding and put on programming for their schools. I do have a flyer, and Martha, I at first said, I don't have any, no, I'll put one together. So it's the greatest And I didn't end up with very many copies, so I will send out a PDF to your group that you can send out. And when I have a little more professional, I will have also social media channels on that website at some point. I just got the thumbs up for that. It seems like things are moving, they're moving in a good direction, but maybe not as fast as I would like them to, because I wanted that yesterday, but we're getting there. And then I will have a QR code as well that we can put on information. So let me know what I can do.
I'm Wanda Fedorchik with Buffalo County Community Partners. I wear two hats, substance abuse prevention coordinator and the central navigator for our community response team. So I brought some more parent resources back there, those Operation Parent Handbook, if anyone wants any. If there's not enough out back there and you want more, let me know. You can also go to their website, which is on the back of the book, and order some of those for yourself. I don't know, we still have funds available if there's gaps in resources in the community to help serve families with their basic needs. We always start those connections in the community with our existing resources like Jubilee Center and Community Action, Salvation Army, and then if there's a gap in funding or a gap in needs, we can potentially help with that.
I'm Doug Kramer. I'm with the Buffalo County Attorney's Office. I'm with the Juvenile Services Unit as truancy and diversion. We work with about 600 to 800 kids a year in 3 different programs. Jennifer Church is the truancy officer. Staying busy, solid, steady. We refer program or youth out to different providers in the community, Boys Town, Compass, Health Partners. You guys help us with the data collection and just kind of making sure that we continue to apply for community-based grant funds through the Nebraska Crime Commission each year. We also do the diversion program for Sherman County. We work with Central Mediation on their truancy program that they do up there. Pretty much it. I'm also the secretary for the Kearney Elks Lodge and the district deputy for all 6 lodges in Central District. This year, the Kearney Lodge donated $12,000. We'll finish our year in March. We donated $2,000 to the Kearney Family YMCA for the Creative Arts Program. We also donated $2,000 to the Compass or to Crossroads Mission, too many C's to have to remember. They use it for their food pantry there and also their homeless program. Normally we have between $7,000 and $20,000 that we have access to. So if there are needs in the community, one of the nice things, JC Pohl is our grant writer. If you're familiar with JC, she's also on the teammates board. She does the Dancing with the Stars. I don't know when she sleeps because she does so much stuff in the community. But she's going to be our president this next year. She'll be the second back-to-back female president. They call them exalted rulers, but I could never get my wife to call me that. So president is what I had to settle for. But the Kearney Elks Lodge is 118 years old. And so it was about time last year that we had our first female president. And so we have JC will be the incoming one as of April 1st. So if you see JC, tell her congratulations. And tell her that she needs to get sleep.
I'm Kathy Gifford, and I'm currently the chairman of the Buffalo County Community Partners, serve on the county school board, and teammate, and whatever else somebody needs me to do, if I can do it. So thank you, everyone, for participating in this group.
I'm Sarah Piter. This is my first meeting, and so thanks to Alexandra for the invite. Looking forward to learning about all things that this group does. I am currently the director of preschool and elementary education for Kearney Public Schools, and we would need to order in supper if I talk through all of the resources and the programs and supports that we currently offer for students, families, as well as community members. So I'll just highlight a couple of initiatives. Obviously, preschool and kindergarten worlds are really starting to amp up, talking through transitions, getting our kids and teachers acclimated with each other as far as those preschool kids coming into kindergarten, as well as parents, getting parents acclimated with this whole new concept and world of kindergarten as well. Our preschool teachers and early childhood staff does a phenomenal job of, working to get some of those events going. And so I think there's a parent program coming up here shortly to just kind of help parents through this first time world of kindergarten and public school. And then as far as the K-5 sector, we're just really putting a big emphasis on analyzing data of the whole child, not just the ABCs and 1, 2, 3s, but looking at a lot of the SEVL data and then using that data to really guide support for our kids. And so teachers are working hard to get into weekly PLCs within their grade levels, within the buildings, to just look at data and determine what best supports kids need, so that we can make sure that we're highlighting all of those 40, the bottom of the 40 developmental assets as we go up, and just making sure that kids are successful. So thanks for having me. And there's so many organizations that, as I'm learning in this position, that partner with KPS, and we cannot do what we do without all of you. So thank you very, very much.
I'm Tana Miller. I'm the Behavioral Health Coordinator at Community Partners. I will try to keep within my 60 seconds. I'll share just two things. One, there is a flyer on the back table that is an opportunity for raising your grandchildren. It's a 6-week series that's came down from our statewide partners, but it's a virtual opportunity. A lot of grandparents raising their children, they don't have the same resources that they did when they raised their children. So it's an opportunity, kind of like a parenting class, but for grandparents. So if you visit the resource center, please take one of these. And I think we've sent it out to some of you as well. And the other piece that I'm just going to share is more of a gap and not necessarily a resource. Some of our early childhood people around the table have heard this, but we had the opportunity for 2 of our childcare center directors actually to share with some business in the community. And I just want to bring it to this attention. One of the examples that was shared was one of our center directors had hired 23 new staff, and then within that week, 15 of them quit. So those are the childcare staffing situations that are common for all of our childcare providers in this community. So just think through turnover, costs for our childcare directors and centers, and then just thinking through that this is not necessarily a childcare spot issue, it's a staffing issue, right? So when you talk about there's no childcare, but really it's a staffing issue. So I just wanted to bring that up because that was at one of our meetings earlier last week. And so just bringing that up as kind of one of those gaps that we see in the community.
I'm Libby Harsh. I'm a childcare partnership coach with Erin. She had alluded to the meeting on the 14th, so we did bring some of those there on the back table. And then I also sat on the Week of the Young Child Committee. And so Week of the Young Child is that first full week of April. And so on that Tuesday night, we'll have an event at the mall, similar to last year. So if anybody's wanting to have a table there, they should contact Chelsea Bartling. And then Thursday night, the 6th, we'll do the parent night at Bright Futures that Sarah was talking about. So we'll get those parents of kids that are going into kindergarten into our building, get them some information similar to what we did for the providers back in January.
Hi, I'm Paige Mock. I'm a social worker at Kearney Public Schools. I work at Horizon Middle School. My job is to serve as a liaison between families and the community. So I love coming to these meetings and hearing about all of your initiatives. Currently at Horizon, we're really working to help kids feel more included in their community. And so we've been trying to start more after school clubs. And so that's kind of what we've been working on.
My name is Veronica. I'm a prevention coordinator at the Safe Center. I want to thank Ellery for bringing up Teen Violence Awareness Month. So February Violence Awareness Month. Hope and I and some other staff members have created content for our social media platforms on the Safe Center on Facebook and Instagram. And for Verify, Verify is our violence prevention resource, really geared towards youth and young adults. So we're providing basic awareness and content for youth and young adults. So if you're interested, check out the information on there. I think today we just posted some information geared towards parents on how to talk to your children or children about dating abuse. So
yeah, and I'm Hope. I'm from the Safe Center.
I'm Denise Streeter, Executive Director of Buffalo County Community Partners, and just wanted to let you know that many of the staff that were sharing programs and the grants that are now available, we're moving into like our last 6-month stretch on a lot of those funds. So if there's anything around substance abuse prevention, mental health, forward developmental assets, any of those evidence-based strategies that we receive funding for in the community from social emotional curriculum, whatever you might have a need for right now to help support your strategies, let us know, because there might be the opportunity for some of those funds to be reappointed if they're not all being utilized. And we're seeing that already start to happen. And with all grants, you have kind of that year end where you have to get some of those dollars spent. So just know if you have some needs, get in touch with one of us because we would be able to help you with that. And the other thing I want to just mention, another layer that we're adding to community response is a connection with our employers. We received some funding to help employers retain employees by meeting their basic needs. And so we've had a conversation through the Economic Development Council and some of the employers that come around the HR roundtable to begin talking about what that might look like. And so far, we have several employers from West Company, Baldwin's, Eaton's, UNK, and Cashway, I believe, were the main ones. Chief, that was the other one, all very, very interested. And I think that's some childcare providers as well that are interested in this piece. We would work with that human resource person to make sure that whatever is happening within that workplace for an individual that may be around the inability to support their housing costs or their food or whatever that might be, that would, if we could help support that piece, could they then help retain that staff member. It was very exciting this week. We got a reach out from Eaton's. They hired 2 people. They reached out for childcare supports and for housing support. So that's exactly what we're wanting those employers to start reaching out to all of us as agencies to learn more about what the community has available to help retain staff. So we're just starting a pilot. We're just dipping our toe in it. We're not ready for the full onslaught of all staff retention needs, but we really are just looking at how do we fill basic needs for individuals, and can we prove that by filling those basic needs that people can continue to retain their jobs. So that's some of the focus that we're working on right now.
I'm still Jason.
Matt. And I'm still Matt Morris with Community Partners. I don't have any updates, but I will go ahead and go through the Zoom chat and share on behalf of our Zoomers today, if I can. We got 12 people, looks like. So Amber Cochran, Hot Meals USA, Leslie Martin, Early Childhood Coordinator for C4K here in Buffalo County, Keisha McCoy with Compass, Candy Koenig, the Parent Resource Program Associate with the Monroe Meyer Institute, UNMC, located at Children's Physicians here in Kearney. Sam Kine, DHHS Child and Family Service Specialist, Supervisor of Investigations, no update. We have also Jewel Schifferns, who is the School Social Work Coordinator with Children's Hospital and Medical Center. She works with the Nebraska Department of Education and schools statewide to support school mental health initiatives. Shauna Worth and from C4K. There's going to be, it looks like C4K ARPA capacity funding opportunities coming soon. She plugged a link in there, and any links that might be in the chat, we'll make sure to get into the minutes as well. Then we also have Peggy Reicher with the Brain Injury Alliance of Nebraska. They have the Brain Injury Conference at the Eunice Conference Center on March 23rd and 24th. And then the conference information is available at BIANE, Brain Injury Alliance Nebraska.org. And also March is Brain Injury Awareness Month. Keisha shared from Compass upcoming events. Saturday, March 18th is at 10:30 a.m. is the Shamrock Shuffle. And then she plugged in a link to volunteer and or run in the race. That event helps support Compass, so please feel free to share. And then TRAC Teen Reach Adventure Camp for girls is June 16th through 18th, and boys is June 25th. And then we also have Dr. Krista Fritzen. She's a licensed clinical psychologist and the UNK Psychology Director of Beacon. Central here and also on the Central Nebraska Loss team. Current events, she shared ARPA grants distributed with many new programs, beginning with mental health services. Mental health first aid for adults is on this Saturday, it looks like the 25th, from 9 to 4 at the Akingay Conference Center at UNK. And then there's a youth mental health first aid training also this Saturday at 9 to 4 at the same place. Social networking events, monthly gatherings. First one is tonight at the Alumni House, 2222 9th Ave from 5 to 6:30. The next is Wednesday, March 22nd, and then April 26th, Trauma 101 online training on the 29th of March from 10 to 11:30 a.m. All require pre-registrations. And then she plugged in a couple emails in there, and we'll get that in the minutes as well. And then we have the last one, Shelley Witt, DHHS, who is the prevention community support team of DHHS. I'm trying to see real quick if I missed anyone. I don't think I did, so on you.
Everybody, I'm Emily Lehman with Unite Us. If you want some additional lunch, there's a lot over there, so take another one with you. I'm not taking it back with me tonight, but it'll get dropped off somewhere in the Kearney region. The only update I have to share is that we're working on a possible partnership with Department of Education regarding LB 852. So if you guys don't know what that is, a legislative bill that was passed recently that all schools have to have a resource directory that's accessible regarding mental health providers for students and families. So we're working on a possible partnership with Department of Education to provide that resource directory that we have worked with 211 on. So that's pretty exciting stuff. And if we do that, that could be 1,200 schools that we onboard across the state that will then have access to send and receive electronic referrals and have access to all the providers. So pretty exciting stuff. There are some resources over there. There's a Unite Nebraska flyer and then a 211 flyer that has a QR code in the corner where clients can scan that QR code if they're tech savvy. And then they can self-refer for services as well. It doesn't just have to be an electronic referral from a provider. I do have some QR codes with the same thing on them. QR code and then business cards. If anybody's interested in seeing a demo of our platform, just grab a business card and reach out to me and I can put something together. That's all I have. You have anything else?
I'm Alexandra Dillon. I'm the Early Learning Connection Coordinator. I support 23 counties in central Nebraska, educators of children from birth through age 8. So that's child care providers through 3rd grade teachers. And do a lot of work with the Communities for Kids initiative, the states that I support. Just 2 things. Krista's first aid mental health is eligible for licensing hours. So if you know of child care providers that might be interested in that session, they can get licensing hours. They're required to have 12 licensing hours, professional education a year. 2 conferences are coming up for early childhood educators, one in Holdridge on March 25th, and our conference for Spanish speaking providers is in Grand Island in April, and that conference is 100% in Spanish. So if you're coming and you speak no Spanish, we'll have a headset for you.
Anybody want to share anything else? Okay. So we're gonna refresh our collective knowledge from our last meeting. So overall, our goal is making a connection with parents to support family well-being, focusing on parents with children 0 to 3, and pre-adolescence when brain development is at its greatest potential. The second thing is to create a shared document for work group members to use talking points to host a conversation with a parent or person with lived experience. And this needs to include our goal, problem statement, and ideas. Work group members want to know kind of what questions to ask parents when they're gathered and how that ladders up to the work group. And then the third thing is to create a shared document and a short list of places where parents gather in which to host a conversation. So that's somewhere in the community, that's a business. So those work group members making recommendations on this list would be the host of the gathering, which kind of leads us into the next part of our meeting. So we're going to do some skill development with talking points. So this is where we're going to do some role playing. Talk a little bit about that.
Sure. So we thought some of the conversations that we had in small breakouts were, you know, what's the conversation need to look like when we're inviting parents? How do we do that? What's the point? So we're just going to do a quick little fun interaction to provide some basic language. And then we're going to ask you guys to go into groups just to find your own way to invite parents to an experience where I don't know if we've decided yet if it's a dinner networking first or if it's an orientation. Those are things we can talk about. But we want parents involved so that we have that reality check from their perspective, that we can bounce off solutions and ideas for some of the strategies that we come up with. We all identified as a group that there aren't enough, even though many of us are parents. We need that advisory lens in terms of the reality of what we're talking about. So that's our next step as part of the work group, is to identify people that we can invite, parents that we can invite that we think would be a meaningful contributor to this group. So some people felt comfortable and some people weren't comfortable. So we're just gonna have fun with it and relax and figure out what the words might look like when we do that invitation.
So the other, I guess, piece I want to add to that is we're in a room of professionals that we all wear different hats, and some people have kids and things like that. But we're looking at this from our point of view, not from a community and parent point of view. So we want to make sure that we have the right people at the table, that we have that lens of the voice of the community of parents, of, you know, people that might have children or grandchildren in care, to make sure that we're hitting all the resources in the community, that they're aware of how to access resources. So we just want to make sure we're bringing all the right people to the table, and that it's not just professionals at these meetings.
Okay.
What else? Oh, are we role playing?
We'll do a quick little model for you guys and then have you break into groups, and you'll see on your, in front of you.
This is not meant to be intimidating. Just have fun with it. It's not a big deal.
We'll ask you to break into pairs and then, or groups of three. Somebody just have to do notes and give you feedback on how it felt, how it sounded, just to get you comfortable with the conversation. Okay, so Jason.
Are we standing?
Standing.
Oh, I don't know. Okay. I'm not. Oh, the paper. My husband's more prepared than I am.
Yeah.
So that is that how it always is in your families? Probably not.
Guys, I'm part of a work group that's focusing on the well-being of children in our area, and it's based on some community assessments where it's been identified that there are a lot of families that don't know how to get to resources. They don't know, they're struggling to have their basic needs met. And what's really exciting about this group is that we've got the right people at the table. We've got people who are involved in systems and have access to resources to create change. But what we really don't have that we need more of are parents. And both of you guys have some incredible experiences and knowledge that would really be an asset to this group. And I'm wondering if you would be willing to come. We're going to have a lot of parents get together to just connect with each other, learn more about what the group does, and maybe figure out how much time, you know, in what way you could be a part of that group. Would you be interested in going to that get together?
Well, I don't want to speak for my beautiful bride, but I would be more than willing to enthusiastically come help.
Awesome, that's great.
I thank you for not speaking for me. I would love to come. I'm very excited. We have a child that has an IEP, so any community resources that we could get our hands on would be really helpful.
I think you'll really find that you're connecting with those resources in the work group, and that's part of the goal being there. So I love that you're interested, and I'll get you all that information.
Great, thank you.
Awesome.
Look how easy that was, guys.
So I'm not married.
Yeah. What? That's
I'm not married.
Same. Goodness. Count off in threes. Are you gonna be in a group, Denise, or no? Are you gonna be a lurker?
I'll be a listener. How's
A
that?
listener, not a lurker.
Like I might get arrested.
What happens in this room stays in this room. Okay. Yep, we'll start off with one, with hope that we'll do threes.
2, 3,
1,
2, 3,
1, 2,
3,
2.
Renee, you're a 1. Oh, good. It's okay.
1.
2.
3.
1, 2, 3. No.
Jason, 2. 2.
That truly makes me a lurker, doesn't it?
Number 3 lurker.
So are we pairing with these, like
Like
this
this
set,
really
right?
are?
Or are you pairing off one?
Are we doing all the 1s and all the 2s and all the 3s together?
Okay.
Oh, I think
Can we
you're
just
doing
turn-
1, 2, 3s.
Can we just turn to our neighbors?
Yeah.
We don't do 1, 2, 3s.
So like 1, 2.
Your group of
Yeah.
friends.
Yes. And then we'll.
And then,
Oh,
but I think a really good point, you can practice this as if the child doesn't have 2 parents too. So
Yes. Yeah, we're not really married, so.
Okay, come on over, Doc, let's do this.
Okay.
So how did that feel? To talk a little bit about what you're doing on this group, what's the purpose of this group? Did that flow evenly for you, or was it a little hiccup? Did the document help?
Do you have a mental list of people you're gonna approach? Oh, yeah, crickets, that's a quite.
We can pick some people in mind that I wanted to ask. It was a good practice because just we came up with questions I wouldn't have considered, like what's the time commitment? How many times are we meeting? What am I getting out of this?
Great.
We're not getting on what they're getting out of it and not how they're gonna be helping us. We're just good things to remember.
Can you capture those questions too, Alex?
Well, as I said, I was being kind of abrasive, but I put my old hat on of, putting on a nutrition program and nobody shows up. So they don't show up because they don't have a car, they don't have childcare. Maybe they don't have the proper clothing, they're not interested in education, food channel would be okay. You kind of have to get rid of those barriers and maybe even focus on coming to them in a less kind of formal way. I don't know. It's hard. And
What you're sharing too, Renee, is exactly what we talked about at the last meeting. So that's very helpful. All of our memory in that piece, because we wanted to know where parents were to really help eliminate that barrier. So if you're thinking about, you all brainstormed great ideas at the last meeting about where parents are and how you would take this conversation to them. And then you asked us for some talking points, and then you said, what is the goal, really intended goal of us having this conversation? So we really wanted to practice that. The next piece we want to move into is, okay, do you have some ideas of who you might take this conversation to? And I do want to ask the online people if they have any other additional feedback before we move on to that with Emily. Any feedback on the Zoom group?
So we really got off of the topic a little bit, but one of the important thing that we talked about is that there is a family advocacy unit as part of the DHHS prevention team, and Samantha can talk better about how they work directly with families that have conflicts or complaints or problems with DHHS. But another part of their role is that they are involved with developing policy and reviewing legislative updates and having some input into that. And they also would be really helpful in identifying persons with lived experience and helping facilitate that conversation with how to get them involved in our groups. And I apologize, I actually thought that they were already connected to this group. So I will make sure I get the information to you so they can be invited next time.
Shelley, so if I'm hearing what you're saying correctly, that there are some parents that DHHS is already working with, and that these conversations could be hosted by some of the folks at DHHS, and there's possibly a parent that might be involved in being at this table with us.
Absolutely. Yep.
Okay, great. Okay. Other feedback from the group, from your conversations? Did that kind of roll for the rest of you? You kind of were thinking about how you might present this to a group? Yes.
One of the things we talked about was you have to get rid of the words like systems
your voice. I mean, those are clinical or professional terms that we're used to. We have to talk to parents as this parent.
Even
And not
input.
use Input.
And yeah, that's like, sometimes I have to just say, what are your ideas about, other things that we could do to help? Just, some of those, the verbiage, I think I said, we're looking for parent voice, and Doug's like, no. Voice doesn't connect, I'm like,
I'm not hearing voices.
yeah.
Like, are you always a lot through the why here, the conversation with the parent, we do have.
We also talked about time of day that this meeting might have, because with some of the questions you guys are like, how much time, when, how, whatever, 'cause I work the night shift, where am I,
I think the beauty of this is that's not our job, right?
No.
You're asking parents. When do you want to meet, right? When do you want to come together? How do you want to be represented in the community? I think we so quickly move to that, how do we solve the problem for parents? And what we're asking is, we know parents are busy, we know you have a lot on your plate. How can we be helpful, and how can your voice be voiced? How would you like to be involved in this work and elevate the things that you find really important for you as a parent? I think our practice rounds went well. A few of you stayed around, so that was good. That was a pretty good session. Only Gabe ran out, so, and I wasn't gonna stop him. I don't know about anybody else. It was Gabe, one hand, Gabe.
He was in such a hurry, he dropped his stocking hat. And he texted me, so if anybody spots that, get it to them.
Does it have the emblem on it? I might wear it around for a little bit.
Is a lurker. Ollie.
Emily, to you.
Okay, next on the agenda, is just like, how do we identify people? Who are we identifying? And then how do we get those names to us or whoever's going to lead some groups? So we do have an Excel document that will be linked in meeting minutes. In the agenda, it was in the agenda packet as well.
Yeah, if you click on it on the agenda packet, it'll take you right there.
So if you have ideas, just go ahead, and this is free to edit and add information to. Just so we have kind of an idea of who to get around the table, and then what location they want to be at, or kind of what that looks like. We've talked about going to employers or having separate meetings. So we just need kind of an idea of how to assist with gathering folks. Did I miss anything with that? Anything else?
I think what you were wanting to make sure they all heard is we want you to sign up here, have a conversation with a parent group where they're at, so you don't have the barriers of transportation, food, whatever those things are, but where they're already gathering, and bring that back to the next meeting.
We did talk about the targets that we've identified, or, the children age 0 to 3 and then 12 to 14. So we're not pigeonholing only those parents though, because everyone that has had parents has a perspective on those age ranges. Is that correct?
I think so.
And I just really liked what what Penny and Renee said earlier when we were having our conversation. They're like, well, what if a parent, has kids with them or something? And we're kind of like, well, maybe they just bring their kid. Maybe we just have a kid at the meeting, and maybe they're only here for 30 minutes, but none of us would care. And it's fine. That's what we're here to do. So,
I'm gonna put Penny on the spot too. She even made the comment, like the whole way in which you do this needs to change. This would be intimidating for some, because it's not on their agenda for education and to be in a setting like this. So it needs to be a little bit relaxed. So
I think we're locked into this table space, right? You're locked into this space. This is the table I've set. We're stepping away from that now, guys. We're letting go of all this, right? Because say, okay, we've created a table that's not welcoming for parents. Now you're going to parents and you say, what would be welcoming? Because we're going to join you parents wherever it's welcoming. We want to make sure you hear that from us as well. Now, that doesn't mean that we can't still come together as professionals and have these conversations that are important. We can do that. But in order for us to be successful, we've got to let go of all this today over the lunch hour that works for us. Am I speaking on behalf of the leadership team?
Yes.
When I say that. That's what we're looking for. Parents who will step into that space and be comfortable in that space and help us create that space.
I think today is about finding those groups and the parents, and then the next meeting in March would be to dig into those issues and how do we create it.
Yeah, because if we create it today, I guarantee it's gonna look a lot like it does right now.
So like, I talked to Jen at the Children's Museum and we were talking about going where the parents are and she's like, Children's Museum? Yeah.
Yeah.
So.
I think it's very important that we use several settings, because I think you get a different response. Depending on the setting, so I really like the idea of employers. If some of those that are partnering with us in early childhood would be willing to let us go into their facility, I think that would be perfect, because we're going into their ours.
I have a question or clarification on the spreadsheet. So if we have an idea that we want on the spreadsheet, does that mean we're committed to then following up with that? Or are we just posting ideas there and then anyone who says, oh, I have a connection there, I can do that?
Yes, no. I think the purpose, we wanted to make sure, because we could create a really nice long list, and then we would have a list and say, okay, who's gonna do the work again, right? So if something goes up on this list, we're asking that person that put that there to help host that conversation, or to have that conversation.
You can co-facilitate with somebody else in the room. I volunteer to come out and do meetings with people if they're not comfortable doing it alone. Just like put a little note in there, and maybe you can have a comment section, or we like to co-host with somebody if you don't want to do it by yourself. We'll have a good group project, shift some responsibility. We've talked about putting talking points together as a leadership team as well for you guys to have.
So I'm the person who puts the thing on there and then I'm going out to the meeting. What am I taking with me? I'm taking talking points. Am I getting a sign up sheet of like their name, email, phone number to follow up with?
Yeah. On that second page, it says, gather names of parents who would be willing to help set this table. You're gonna bring that contact information back to this big group. This table we set in March. Then we'll know what parents maybe are interested in this conversation and decide what that looks like moving forward. And so you're probably gonna be that spokesperson for a short amount of time with that parent that has an interest.
We don't have to be asking for an hour-long meeting. Maybe you just want 15 minutes, 10 minutes before they start doing whatever they're doing. Pitch this.
You could do this while you're paying your fee, walking into the basketball game.
Yeah.
It could happen that quickly, right?
It's like an elevator speech.
Yes, yes.
So the ask, if we haven't been clear, is that before the next meeting, you're identifying and maybe meeting with some individuals, or networking wherever you're at. I've mentioned I'm always networking, no matter where I'm at. I'll get to think somebody about my job. But you're always having these conversations. You're always around other parents. You're always at an environment, at church, wherever, where you can be having these conversations and inviting people. A 5-minute conversation is fine. It doesn't have to be a half an hour. We just want to get some things on the books so we have an idea of what direction to go and what the needs are for future conversations. So we've talked about down the road, like a parents' dinner or something to get them all in the same room, where it wouldn't be like over the lunch hour or something like this, so we can get kind of a pulse on what's happening. So. Sorry if we weren't more
I bring
clear
this
about
up, do we want to bring them here, or do we want to go to them?
Go to them.
I think that's really important, not to go to them to talk to them, but I mean, if we're gonna meet with them, we want to go to them.
Yes, that's the intention.
I think that's,
Very, very important, isn't it?
and I don't know that it needs to be the rules.
No.
I think as we develop those, I mean, maybe there's, think of it as smaller groups to get more information. That what we're talking about.
That's exactly what we're talking about.
I think an example that we used was, so we do work with childcare centers. Some of them have their own parent advocacy groups. And so there's usually probably not a lot, maybe 5 to 10 on there. If they're meeting, we would ask that we could come in and talk a little bit, 5 to 10 minutes, grab some of that information, ask if we can have their contact information, and then bring it back to this group. And then I think you're probably not gonna get all 5 to 10 of them at, you know, the future meeting, but at least if you have 1 or 2 of those voices that continue to stay engaged, that was one of the examples that we used.
So if the Children's Museum was willing to have just a quick conversation with parents while they're there in the museum, that would be fantastic. I don't know if Amber is still on. Amber at the last meeting was talking about an employer. So Amber, if you're still willing to go out and talk to an employer or two, I'd be very willing to assist you with that. I think we kind of talked about going out to Baldwin's and seeing if the employer would allow, you know, a handful of parents to come to maybe a conference room, just to have a conversation. So we kind of talked about that as well. Other ideas that you're thinking of, maybe just to get other people's.
That was just my idea, but I was just thinking I would start like a new notes folder on my phone, and as I'm having those conversations, keep track of it there, so otherwise I'm gonna lose it or forget. So if anybody's like, how am I gonna keep all this straight, that might be an option for you.
Yeah, that's a great idea.
Another thing I thought about too is last week or a week before, I can't remember, the weeks all run together, I attended the Through the Eyes of a Child. Each team or each county has a team that's basically a project by the Supreme Court of Nebraska. It's a project basically to improve juvenile justice court processes for children and families. And so one of the things I suggested is this group, or, you know, inviting people back and forth, because there's lots of different agencies. There's CASA, there's defense attorneys, guardian ad litems, a lot of different people through the courts, Judge Rademacher, you know, basically this team in Buffalo County has been dormant for 3 years, which a lot of things have been because of COVID and all that, but it's, you know, the needs and the things for kids going into foster care, you know, who are actually at that point of maybe parents relinquishing or having their parental rights terminated. There's different things. I mean, when I did child protective services way back in the 90s, it wasn't uncommon when you go to, well, our law enforcement with the kids picked up in their clothes and they put them in a trash bag, which was the worst thing in my mind. I would never do that. And I just said, I can't do that. I'd have to have a suitcase or, you know, something. I would just carry one extra in my car. It's ridiculous. But those are the types of things that, you know, we're working on, is making sure HHS and Department of Health and Human Services does a great job. They don't do things like that anymore, thank goodness. But it's just, you know, people like that can actually, through their case managers, can actually visit with families one-on-one and see what inputs they would have. So.
Other parent groups you guys are thinking of?
Do we have a challenge that like everybody does one?
Yeah.
So, I have,
Yes.
that event on the 3rd that I can have my service providers help me gather some information. I was also thinking about another group Radix app that they always select their challenges every 2 weeks. So maybe inviting them to this group might help us too. They have she's a nurse from Children's Hospital, but she's also part of Radix that will help those parents with challenges. And part of that question, those questions, the last one says, would you like somebody to contact you in regards to the challenges that you've been having in the past couple of weeks? So she does have their contact of the parents, so I can invite them too and see if they're willing to collect that information and maybe part of this group as well.
Oh, fantastic. And I'm gonna try to regurgitate what I've heard today. How's that?
Oh, wonderful, Parker.
Just poke at it if I'm not capturing it well. Your Bible or your talking points on these 2 pages. It was in your packet as well, your electronic packet. We will try to turn around minutes as quickly as we can so you have this in front of you. So here's the research as to why we're doing this work, right? Why we're asking parents. That's just kind of for your information in case there's questions around that area. The conversation is what you practice, the ask, right? You practice that, you practice the why. You discovered there's some language in there that doesn't quite fit you, so you're gonna change that language to what does fit you or the parents you're talking to, because you know them best, better than Denise Weiner. Jason does up here, and you're gonna use different language that is meaningful for the group that you're working with. You're going to go to the second page. If you have the opportunity to ask them, you know, what their wishes are for the community, great information to gather. If you have an opportunity to ask them what resources are working well for them, what a great opportunity to do that. But most importantly, ask them if they would like to come to a table that they help co-design with us, where we have continued conversations about the overall, the why.
A parent
Everybody-
advisory group, if you will.
Everybody's going to take at least one visit with one parent. If you can do more than that, fantastic. You're gonna bring that information back to this group on March 22nd. Same time, same place. Thank you to Unite Us for providing lunch. If you have anybody else that's interested in providing lunch next month, let us know. And then we'll begin having a conversation about what to do with the information you've gathered.
Hey Denise, this is Shauna. I have one clarifying question from you. Is this all just conversation, or is there anything that would be handed to a parent about the information about this group?
Great question. So we've been thinking conversation.
And then would there be anything as far as a promise that's off the table? Such as like, if somebody identifies, well, this would need to be part of this meeting for me to feel comfortable to come. And mostly I'm just saying, I'm kind of alluding to language, like making sure that inclusion can happen. If by chance, interpretation and that could be offered, if it's on the table. Just what are the parameters of what's on or what's not a promise that could be made?
And my sense is, Shauna, that right now it's to collect the information of what parents need to be able to participate and what their level of interest is. And I think I appreciate what you're bringing up, and I think that's what we've got to work through next month, is if we have a population of parents who are very interested and they speak Spanish, then we've got to make sure we find the way to connect in a meaningful way with them and build that. And I think that the documents right now, some of the documents we have could be really intimidating and off-putting. So I think we start with that relationship, that connection that people have, and see if we can then, from that level of interest, then provide more formal communication maybe about what we are. I think we just need to know more about how do we communicate, in what environment, what language. I see this really as kind of a data collection process that everybody's going to be asking parents those questions so that we can make it a forum where parents feel safe contributing. So I don't know if that answers your question. I feel like we're still trying to get those answers.
And we're building trusted relationships, right? That's really our overall goal, is to build that trusted connection to a parent.
And I think, Shauna, you asked if we were giving them something, and in my mind, I probably wouldn't give them my business card, but I'd probably give them my name and number if they needed to follow back up with me, but I would want to get their information as if they're interested in learning more, being more engaged, so.
Archer? Then we could like text them a thing, like, you know, like, if they're like, oh, actually text is the best way to get a hold of me, don't email me anything, then I can text them the link to our Wellbeing Collaborative page, if they're the type of parent that would want to check that out or something. I like what you're saying.
They're all going to come in at different levels of understanding and questions.
I think if anything though, like if a parent is just wanting to say like, you're not a creep, hopefully you're reaching out to people you kind of know. Or like, but like, with that being said, giving them the BCCP website and saying, if you have questions, you know, reach out to me or anyone, like this is a reputable place. I'm not just collecting your name and info for my own identity theft purposes.
Yeah, I looked through this quick, but it's so agency speak. I don't think any of these pieces in here would be helpful. So yeah, I think you're just building that relationship.
From experience, I think this first initial contact with parents is gonna need to be, it's really important because ultimately parents are going to recruit other parents. So if we can be very intentional with the parents that we are reaching out to, maybe they're parents that are already serving on a committee in some sort of capacity, they're very comfortable to some degree in some of these settings, but they're connected. They're all very well connected out into their communities. They're going to recruit other parents. And so I think just being very intentional as you're processing, like I am going to go to this parent that I do know and I have this relationship with, I'm going to get them here. And that connection is going to network you into 25 other options that are going to be really good. And they're going to trust that person way more than they're going to trust us. So parents recruit parents, be intentional with that first contact. And I think once we get the first intentional group in here, it's really going to grow from there. So I don't think the goal should be, oh, we gotta have 50 parents by this date. No, we need 8 really good parents that are gonna be from different walks of life, who are going to feel comfortable speaking up, who are gonna feel comfortable having these conversations. So where can you find those parents? And we all have those groups. It doesn't have to be the parent that's, you know, this stay-at-home mom who never has any interaction. She might not be the best fit to start. But then as you get those people that are comfortable, they're gonna link arm in arm and they're gonna come and they're gonna rock it. So.
Very well said. All right, we've done our next steps. Questions? You have this great, fantastic leadership team. Make sure all your questions go directly to them.
Alex. Alex. We'll field all of your questions. Just kidding.
Thanks for coming, everybody.
Next meeting is
March 22nd.
22nd. Thank you.
Take a sandwich.
Thank you.
6.
Thank you.
Feed your family, or your